situation to further increase your testing, sequencing, contact tracing, hospital capacity to be ready and learn the lessons from last year. Thank you.
Thank you. Katie, would you like to add anything to those points by the regional director?
Thank you, Rob, and thanks for the question. Honestly, I think the regional director has said it all, so I have nothing to add.
Great, thanks very much. Okay, next I'm going to go to, I can see Maria Cheng from Associated Press is with us. Maria, please, the floor is yours.
Hi, thank you very much for taking my question. I appreciate it. I have a question about U.S. President Biden's announcement yesterday that the U.S. will purchase 500 million doses of the Pfizer-BioNTech vaccine, of which 200 million will hopefully be given to countries through COVAX later this year and the rest next year. I wondered if Dr. Kluger could comment on how significant that is and how far does that go to addressing the vaccine equity issues that you've talked about previously. Would you rather see countries donate vaccines now? Could you just put this in perspective? Thanks.
Thanks, Maria. It's a very important announcement indeed. 500 million vaccine doses to COVAX to distribute to 100 countries. Let's remind what our WHO Director General, Dr. Tedros, mentioned recently, that we need about 10% of the population of all countries covered by September and 30% of the population of all countries by December this year. For September, this would mean 250 million doses extra, but particularly in June and July. So to answer your question, we need indeed the doses now. It's not only a matter of money, but the actual vaccine doses. So we welcome this very much. Of course, we're very much looking forward to announcements by the forthcoming G7 summit, because they do have a tremendous economic power to help the world getting out of this pandemic. But at the same time, we need to look for long-term sustainable solutions to fully fund the COVAX advance market commitment, and as we discussed a number of times, to really drastically scale up the vaccine production. But of course, it's very hopeful. Thank you.
Thank you, Maria, for the question. Thank you, Regional Director. I'm next going to go to Gunilla von Hall from Svenska Dagbladet. Gunilla, good morning.
Yes, can you hear me?
Yes, please go ahead. Thank you.
Yes, thank you. I'm sorry, I just came in a bit late on the press conference. I hope no one asked this before, but I have a question on this Summer Sense campaign that you're launching. What makes you launch this now? You're saying if you can postpone your travel during the summer, it's the right thing to do now. Why are you saying this now? What is worrying? Is it the variants? And don't you think it is a bit late to come with a campaign like this now when people have already made a lot of their plans for the summer travels in Europe? Thanks.
Thank you very much, Gunilla, and welcome back. Regional Director.
Thanks, Gunilla. So, a key word is pragmatism. So people have been suffocated for quite a long time. We're very concerned about mental health issues and well-being. So in that sense, people are making plans. So we need to do it all, right? First and foremost, I call it, in fact, a VIP approach, the V from variants. Yes, we are very concerned because in a number of countries, the Delta strain variant of concern has overtaken the Alpha one, and we need to beef up sequencing. So that's the V. The I from immunization. We need to further drastically scale up the vaccination part and also overcome in a number of countries vaccine hesitancy. And then there is the P from politics, that the politicians to further base their decisions on sound scientific epidemiological data. Because we have this seen also before, right, that the science was not always in the lead, and we should take this lesson. So the campaign is rehearsing somehow the key messages we have been giving all along and to appeal to the common sense of the people.
Katie, can I ask you to add a few points, please? Thank you.
Thank you very much. for the question, Gunilla, and just to extend on what the regional director said. In some ways, in his statement, he made it clear we've very much been here before. We entered the summer last year with cases going down. Countries are now taking measures to lift travel restrictions, to open up societies. This will result in more travel, both domestic and international, more population movement, and more gatherings. So we do know from last year that over the course of June, July, and into August, cases rose, especially in younger age groups, gradually, very gradually. And learning from that, and given that we have a particularly concerning variant that is not yet prevalent in the European region, but in some countries has already displaced the Alpha variant, which is the predominant variant in the region, and will take advantage of any opportunity it has to spread very quickly. We've seen very significant evidence of significantly higher transmissibility in that variant. We've seen initial basis for increased risk of hospitalization, and we've seen some evidence of immune escape, especially after only one dose of vaccine. So in the current situation, our assessment is that this does pose a significant risk in the current context in terms of community transmission, and in the context of the significant variation in the uptake of vaccines among over 65s and vulnerable groups. So we do see a risk of a resurgence of cases, and that's where the Summer Sense campaign comes now as people are taking decisions. They still are, because people have delayed decision-making to wait for what rules governments put in place. And it's our opportunity now to reach out to communities and rely on the common sense of people to make good risk-based decisions and personal choices. At this moment, 18 months in, a community-led response to COVID-19 and the pandemic is just as important as the decisions that governments take. So we really will rely on those decision-making over the coming months. And given that we're at this stage now, we feel the need to re-emphasize and provide information and tools to people as they're making those decisions and taking their own decisions based on their own personal risks. Thank you very much.
Thank you, Katie. Siddhartha, would you like to give us something from the vaccination aspect? The regional director referred to vaccination, but also vaccine hesitancy. Could I ask you to chime in here? Thank you.
Thank you, Rob. Thank you, Gunilla, for that question. And I think in continuing where Katie left, and I think if you, as we see since last year, our WHO's advice had always been around, the gatherings and how people can avoid as much as they can. But vaccination, understanding of vaccines, effect of vaccines on variants, and the increase in vaccination uptake has been a phenomenon that WHO has been following very closely. These all knowledge also played a big role in ensuring that this advice or the suggestion to the community in general is apt at this point of time. More and more vaccines are becoming available, and this is also providing that additional tool in our toolkit to bring an end to this pandemic. While vaccination has been talked about in a community, it's also important that these messages around do it all, as you have heard from the regional director, is making real good sense now to put it back up in the discussion. And I think bringing in the issues around people's perception around the vaccine and ensuring that the community understands that vaccine is important. We have heard from the regional director in his initial address that when opportunity comes, people need to come forward to get the vaccines. People's perception need to be addressed while ensuring that the vaccination uptake goes high. So I think this is an apt moment to bring all these components together in one campaign. Thank you.
Great stuff. Thanks very much. Now, we have a question from Emin Aliyev from Reporter Z in Azerbaijan. But before I get to that, please to remind you, the journalists joining us online, that you can raise your hands if you have a question, or I've just opened the chat box also. We've now got access to that. If you have a question, please do type your question into the chat box and I'll see it here and read it out in case you can't raise your hand in the system. So to Amin's question from Azerbaijan, Latest reports say that you will visit, and this is to the regional director, latest reports say that you will visit Azerbaijan as part of your regional trip. Could you please share with us the exact dates of your trip to Azerbaijan? Will there be any meetings in the country? And if yes, who are you going to meet with? What topics are going to be discussed here? Regional Director.
Absolutely, Emin. Recently we had the video conference, Dr. Tedros and me, with the president, the head of state of Azerbaijan, who welcomed me very much to the country. So I'm very much looking forward. Dates are currently under discussion, I hope in the near future. Country visits are fully in line with my vision for health and well-being in the region. The vision is called the WHO European Programme of Work, and it's all about country impact. So going to the countries really gives the best opportunity to look at the opportunities, the challenges, and referring to your question, to meet the head of state, head of government, my direct counterpart, the Minister of Health, who in the case of Azerbaijan, as you know, is a new Minister of Health. Very much looking forward to meeting the new minister and expressing also my gratitude to Professor Oktay Shiralev, the former minister who has done an outstanding job. And then I always take it a point of attention to go also to primary healthcare facilities to reach also the vulnerable people and talk and observe, because that's the best way to reform WHO and to ensure that we are people-centered and really helpful to the countries. So I'm very, very much looking forward. Thank you.
Thank you. Thanks for the question and thanks for that response. I will next go over to David Williams from the Xinhua News Agency. David, welcome back. Can you hear us? David, I can see your hand is raised. Okay, I think we've lost him. I hope we've still got connection to the other journalists. I believe that's all the questions that we have at this point. I don't see any other hands raised or any other questions in the chat function, so it only remains for me to thank the panelists today. We'll be sharing our Regional Director, Dr. Kluger's statement and further information on the Summer Sense campaign. The recording of this briefing will also be online soon. So thank you very much for you all joining. And as always, please stay healthy and take care. And thank you once again for joining us today. Goodbye.